This is the Medical Minutes Podcast on the All Indiana Podcast Network. Your source for the latest news, updates, information, and more from the world of health and medicine. Now, here's Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. Older patients suffering from cognitive decline may have trouble conveying physical and mental health information to their doctor. So they bring a friend or family member to help them out and make sure the information they're sharing is correct. But sometimes there is a disconnect between what patients and Proxies report, leaving doctors confused. In this week's episode, I speak with Dr. Kroenke, scientist at the Regenstrief Institute and author of a new paper about the reporting accuracy between patients and healthcare proxies, who tells me there are certain circumstances when proxies may overestimate or underestimate the symptoms of the patients they're responsible for. Our conversation is next. Tell me about this study. Why did you do it and what did you find?
Well, we have an interest in studying symptoms in older adults. So this is a population of older adults. And a lot of times we use measures like for depression, anxiety, and pain. And we wanted to see how good what we call a proxy is, like their wife or their husband or an adult child is, in reporting for them. Because in some older adult populations, like a population might have dementia or things, they can have these conditions like depression or pain, and someone has to report for them. So we actually studied how well what we call a proxy, which would often be a partner, a spouse, an adult child, how accurate they were in reporting for the patient themselves.
And I know you looked at both physical symptoms and mental symptoms, and there's a difference I saw between the two in terms of the reporting accuracy. Can you talk about that?
Yeah. So in general, the reporting was closer to what the patient reported for physical conditions, including pain, memory, walking, things like that, and somewhat less accurate for psychologic symptoms. And we measured depression and anxiety. So when you're asking a proxy report for those kinds of symptoms, you'll want to factor it in that it may be somewhat less accurate, but it wasn't bad.
And if what kind of consequences can this have if someone isn't cognitively able to, express sort of how they're feeling mentally and that, the proxy is off? What kind of consequences can occur?
Yeah, well, I mean, if you don't get what we call a proxy report, if the patient can't report for themselves, you are at the risk of not treating their depression, their pain, whatever other symptoms they're having. So it's better to get a proxy report than no report. And the good news from this study is, on average, proxy report's pretty good. Especially if you're looking at groups, like in a trial, you're comparing one group to another. At the individual level, proxy report's quite good for physical conditions, and I would say moderate for depression or anxiety. But it's better to get some report than no report so that we can treat these conditions, which are very common in older adults.
Well, how common is it for a proxy to overestimate or overreport, underreport? And are there certain situations in which you found these underreporting or overreporting occurred?
Yeah, there's a couple of factors that seemed to affect that. One would be the severity of the symptoms. So on average, if a patient has more severe symptoms, the proxy may actually underreport the severity of their symptoms. So if you're a doctor taking care of a patient and relying on a proxy report, and they report moderate depression, the patient probably at least has moderate depression. The thing that might lead to over-reporting is what we call caregiver distress. So a lot of times caregivers, may have a lot of stress and stress themselves. They may tend to overestimate symptoms, but that's maybe because they bring a little bit of how they're feeling to the table.
That makes sense.
Not surprisingly.
Yeah, I was going to say, are you surprised by these two outcomes? And then what do we do with this information? What do we do with this information now that we know this?
Well, there's two situations where it might be most helpful. Well, the one I already mentioned, if a older adult is unable to report for themselves, and there's some concern about are they suffering from depression or pain or anxiety. This is pretty good news that we can rely on proxy report to give us maybe a temperature reading on those symptoms. The other situation would be, what if the patient can report for themselves? Sometimes their partner or spouse or adult child says, well, I don't know. They're not saying they're depressed, but I kind of think they might be. It might be useful to get both views because maybe the truth is halfway in between. So I would say even when an adult can report for themselves, if somebody else is giving additional information, I think we have to kind of factor those two views in.
And then, Dr. Kroenke, what is your message to doctors, patients, and caregivers, given what you found?
Well, I would say if you're taking care of a patient, an older adult, and particularly if their own reporting becomes impaired because of dementia and some things, then you will want to ask their closest caregiver, how they're feeling. Have they noticed anything like depression or pain? And then get their judgment about it. We have these scales you could use. So we would use the proxy as a substitute for the patient. And this study indicates that we can do that.
And then what about for patients themselves? I mean, I don't know if patients are maybe hesitant to bring someone in with them, saying that I can do this myself. And I mean, I think it's always good to have someone else when you're sort of going through something, but especially in these instances.
Yeah, I think the two situations where a patient can report for themselves where this could be useful is it's not uncommon with older adults to have someone attend their visit to the clinic, actually even come into the office sometimes. And I think then getting the information first from the patient makes sense, but verifying if there's any question to see if they're in agreement. I think that's one situation. The other situation is if the doctor suspects something, like I think this patient may be depressed or in pain, but can't get to the information reliably from the patient, they should then ask a caregiver. So I think if those would be a couple situations that could be useful.
And then lastly, your message to caregivers.
With caregivers, I would say the message would be that if they're living with a partner or a spouse, or an adult child has an older parent in the home, that if they suspect something is wrong. And again, we studied common things like depression, anxiety, pain, things that we can't measure, like with a blood pressure cuff, that if they're suspecting something that the patient isn't feeling well, they should feel comfortable bringing it to the physician's attention because their report can often be on the mark.
And then, Dr. Kroenke, anything else that I missed that you'd like to talk about? We have about 30 seconds left.
Well, just that I think from both the doctor and the patient standpoint, realizing that we can get helpful information from a third party sometime, which would be the proxy. That can help both the caregiver, the doctor, and the patient.
Okay, well, wonderful. Thank you so much for taking the time. I really appreciate it.
Okay, thanks, Mary.
This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
This is the Medical Minutes Podcast with Wish TV's Dr. Mary Gillis. Be informed and stay connected for the latest news and information when you like, subscribe, and follow this podcast and discover even more from the All Indiana Podcast Network. Now at allindianapodcast.com.